The COVID-19 Epidemic. Information to know by Brodin. This is the COVID-19 microbe. On the outside, it has spike glycoprotein, which acts as Velcro inside of the human body. On the inside, there's RNA and N protein. It also has an envelope on the outside. It is not a living organism by itself. How is the disease transmitted? The disease is transmitted through close contact with an infected person for the most part. It can also live on surfaces for up to 72 hours. More in depth, infected people talking, coughing, or sneezing release respiratory droplets. These droplets are very contagious and can get on surfaces or on your hands, or you could inhale them. Some people are wondering, is the disease actually dangerous? Yes. Yes, it is. 14% of corona cases are severe, 6% are critical. The fatality rate averages 2% among people who contract it. It is indeed dangerous. The average person can infect 2.2 other people. Not can, but will. And coronavirus symptoms can take up to 14 days to show inside of a person. That means that person could think they were uninfected and go to the store or keep going to their job, all those things, and infect even more than 2.2 people. Who are the most susceptible? People over the age of 65 are the most susceptible age group in today's society. Also, people with pre-existing conditions are very susceptible. People with pre-existing conditions, in addition to being susceptible, have a much higher death rate. This is a chart provided by the Chinese CDC of an observed group of people who had pre-existing conditions that came into the hospital with coronavirus. As you can tell, there's a much higher death rate. What COVID-19 symptoms should I look out for? The first thing I want to say is do not panic. It's cold season, it's flu season, and although there are some coronavirus symptoms that do correlate with colds and flus, don't panic because it is more than likely a common cold or a flu. The common cold has itchy eyes, stuffy nose, and sneezing. Although a stuffy nose and sneezing can be a sign of coronavirus, the majority of the time they are not. The flu and the coronavirus both have fevers, fatigues, body aches, cough, and worsening symptoms in common. But unlike the flu, the coronavirus has a shortness of breath along with it. That being said, there are varying levels of COVID-19. 80% of cases are mild to moderate. These cases range from asymptomatic to people who need ventilators to breathe. The cutoff for moderate is not needing oxygen in order to breathe. So if oxygen is not needed, then it falls into the case of mild to moderate. 14% of people contract a severe form. The severe form is defined as needing oxygen in order to breathe, so you can't breathe on your own and you need to be hospitalized. 6% of reported cases have been critical cases. Critical cases can lead to multi-organ failure and are much more likely to have other severe complications. Other severe complications can be pneumonia, acute respiratory distress syndrome, or ARDS, cardiovascular shock, heart damage or a heart attack, and permanent lung damage. Some people who have survived the coronavirus and recovered have 20 to 30% reduced lung function and will always have 20 to 30% reduced lung function. Now that you know the types, you may be wondering, what does COVID-19 actually do inside of a host? Coronavirus is a respiratory disease. It attacks the cilia. Cilia prevent debris from gathering in the lungs. Eventually, Cells in the lungs get infected when the cilia die off and are not there to stop the debris from being inside the lungs. Basically, it's bad for your lungs. That's why shortness of breath is a common symptom and coughing. What environment does COVID-19 need in order to spread? COVID-19 survives for shorter periods of time at higher temperatures and higher humidity than in cooler or drier environments. Based on this, we are hoping that come summer, COVID-19 will have a harder time spreading. But it needs to be acknowledged that just because it has a harder time surviving at higher temperatures and higher humidity does not mean that it can't survive in these conditions. Now you may be wondering, should I move to an isolated desert island in order to stay safe? Although that would make it slightly safer, there are much better alternatives than this. One of your best defenses is going to be washing your hands. Before meals, after meals, anytime before you leave your house and after you come home from your house, you should wash your hands. You should wash your hands with warm water because washing your hands with warm water breaks down the lipid barrier on your hands where the virus and other germs can live. Another thing you should definitely not do is touch your face. When you touch your face, if you have any form of the virus on your fingertips or your hands, you're putting it closer to a place where you can ingest it, whether it be through breathing or eating, anything along those lines, and you're making it much easier for the disease to spread. Another thing you should do is avoid large crowds. You should avoid large crowds because a majority of large crowds do not follow social distancing protocol. What is social distancing protocol? It means that you're 6 feet away from all non-immediate family members at all times. And 6 feet is the recommended length by the CDC and other credible sources because 6 feet is a safe distance at which you can talk to somebody and the droplets will have a much harder time of getting to you. The droplets from the other person, that is. Another wonderful defense is to stay at home. Currently, many states have a stay-in-place order. That means that you cannot leave your house unless it is absolutely necessary or you are an essential worker. They're not doing this for no reason. You should not leave your house unless it is for groceries or some other very, very, very important reason. This is because we are trying to slow the spread and flatten the curve. You may be wondering, what does flattening the curve mean? Imagine the dotted line is the amount of people that a hospital and healthcare workers can accommodate at this current point in time. Imagine the higher up curve is what happens if we all continue to go throughout our day-to-day lives, or even just a decent number of people don't stay at home and continue doing what they're doing, just continuing their lives. You can see the curve goes far above the dotted line, which means that hospitals are maxed out, healthcare workers are maxed out, and basically a lot of people are going to die in that situation. A lot of people that could have lived and deaths that could have been prevented if the curve ends up looking more like the blue curve. Now, you may be wondering, what does this blue curve represent? The blue curve is what happens if the number of coronavirus cases is the same amount but spread out over a much larger amount of time. When it's spread out over a much larger amount of time, the hospitals and doctors and healthcare workers can provide care to everybody who needs it. And therefore, we can prevent a lot of death. The first curve is what it's going to look like if we do not stay at home, wash our hands, and follow proper social distancing. But if we do what we should and do our part to make sure that this coronavirus does not spread, it will look like the blue curve. We should also make sure that we're doing this for the sake of not only ourselves, but our healthcare workers, who are working tirelessly and will most likely inevitably contract the coronavirus at some point in time. We should also be doing it for the elderly and the people with pre existing conditions. Thank you. Here are my sources. That's the first page, and there's the second page.